Welcome to ReSounding, a podcast exploring the arts in advocacy and in action. We talk with artists and activists, taking a deep dive into the causes of displacement, the strength and the vulnerability of people on the move, and the potential of the arts to shine a light on injustice and impact people's lives for the better. In this episode, I speak with Injonge Karangwa, a Rwandan singer and songwriter, and the chief organizer of the Hamge Festival. We discuss how understandings of music, health, and well-being shift between cultures. We're joined today by Injonge Karangwa, who is Director of Arts and Culture and Public Engagement at the University of Global Health Equity in Rwanda. Injonge is also the founding director of Hamge Festival. Injonge, great to have you with us.
Thank you for having me. How are you?
Yeah, I'm good, thanks. When we first met, I remember being so happy. I said the same thing to Christopher Bailey from the WHO, that I'm so excited that your job exists and that arts and culture is a part of what the University of Global Health Equity is doing. As you know, I've been fortunate to be invited to be part of the Hamge Festival, and again, so excited that such a festival exists and is produced from Rwanda. Maybe you can start off just by explaining to us and elaborating on what it is that you do and how your role is carried out and all the different facets of what you're doing.
Sure, my pleasure. I'll do that. So my role existed. I don't think that anybody planned for that. It's really a reaction to what we were doing. So it all started by so I'm trained in global health, and I've spent the last before doing that 10 years working on different health systems, different positions, working on vaccine supply chains, nutrition programs, and on the side, I'm a musician. I write poetry. I have all of those different projects, and then suddenly, slowly by slowly, I had the wish to see my two words becoming one. And it came from start, and I was seeing what my own art practice was doing to me, how you get energized, how it eases the mind, and how it gets you balanced through stress or through any type of experience. As a researcher, I get into the great literature, and I was like, wow, there's a body of evidence that actually shows that it's not my own feelings. It's actually there's a neurological process, and a lot of things are happening with an art practice, with music, with writing, with sharing experiences, with connecting through arts, with singing together, with talking to an audience, and all those experiences I was having, and I get passionate by that, and slowly by slowly the idea of Hamwe came, and I proposed it to UGHE. That is actually a great environment for starting new things, because this university is really building itself with the deliberate wish and intention to build bridges across sectors. So when I came with this idea, minds were open, and there was room for doing it. And we started with the first Hamwe Festival in 2019. So it's not so long ago; it went so fast, and the idea was really to talk about what's happening at the intersection of arts, health, culture, and just build the case to interest people into that intersection. But also, there's an audience, and there's all the stakeholders of a health system. And we actually had an amazing response. The policymakers were curious and came. Other researchers came, global health professionals came. Some people actually say, I'm doing that in my hospital. I'm doing this with my patients. And so it was the beginning of the creation of a community. And so because the response was so positive, we started with a second Hamwe Festival last year, the one that we had the pleasure to have you on. We talked about mental health and social justice and the role of arts and from different angles. The opportunity we have with arts is that we can talk about lived experience and own practice and individuality and various cultures. And we really used that in that opportunity in the discussion. So there was questions about research. We had a wonderful conversation about how music can build community and reinforce social fabric and help sharing experience, facilitates therapeutical process and connection. We also had conversations around how arts, being the expressions of oneself and of, sometimes of cultures, place the individual at the center and their own story. And under that, there's a lot of questions that are coming, questions around identity, questions around colonization, questions around colonization, because some places maybe it looks like an innovation to do arts and health, but it's part of the usual practice of so many people around the globe. So why, what happened to this practice? Because it's obviously, it's now proven that arts can be therapeutic tools and bonding tools. So there was very interesting conversation around that. And there we were again surprised. We had incredible participation. One thing is that we organized the festival online, as you know, it was pandemic time. And so people from around the world, 54 countries and 26,000 people. And so there we understand that there's definitely interest. There's definitely research gaps that are emerging. So we will continue that. And so that's how my role was created. We are doing different engagement programs, podcasts, webinars. And the idea is really to move slowly with all this experience and connections. And by connection, I mean exchange, right? All these learnings that we are making also as an institution, we are really collecting them and trying to identify how all this work can strengthen our curriculums and also help creating some new ones. So that's what I'm doing.
Wow. Amazing. Just hearing you speak then, there's so many different understandings within what you're saying of the way that people engage with arts and culture and the way that people engage with their health through arts and culture. You're talking about your own experience of doing art and the effect that has on you, but also about people working to use art in health environments, and also just people engaging with art in general, engaging with museums and the positive effect that can have on people's health. And if I think of that and then think of the idea of health equity with arts and culture, are we talking about equitable access to the arts and culture, plus equitable access to the arts and culture for health, and plus redressing some of that colonial legacy, actually, of the loss of arts practices for health, the loss of culture which was intrinsic to people's health?
Yes, the possibilities are endless, right? And we see that, and that's really something that we were deliberate about, showing diverse type of programs, diverse type of perspective, geographies, expertise, approaches. For Hamwe Festival, that's why Hamwe was created, to show and to discuss everything. As much as we can of what this collaboration of arts and health can generate. We have the benefits of the arts as a practice for the artist, but not necessarily for somebody that does that professionally, for exposure to the arts, own practice and community practice. There's also arts with an intention of healing. And for that, we are looking at the work of others. And I think that's where there will be an incredible opportunity for additional research on what has been going on in many cultures, and maybe valuing knowledge that has been, we talked about colonial legacies, right? Mm-hmm. How the arts give me an opportunity to do things differently. Mm-hmm. Yeah, because how do we change that? How do we remove this barrier between our sectors? Mm-hmm. I mean, to me, a class of children that is singing as they are going to their classroom, they are doing something for themselves. They are creating a bond. They are creating a group. They are creating a community. They are reinforcing what they're going to do as a class during the day. So all of that, I think, should be integrated, and we're looking at all of it. Because there are a few things, because some of those things are so straightforward, but until we don't establish it as evidence, they would not be as valued as, a very research team building exercise that have been created by a consultant that cost millions. So all of this can be, and making it accessible in terms of more breaking down how useful and valuable it is. I do believe that this is working on equity. And after, there is definitely healing practices when we talk about that needs to be revalued. There's always a sensibility. I know when you talk about traditional medicine and traditional practices, sometimes for good reason, but sometimes for terrible reasons. Mm-hmm. Letting research enter into that might revalue very important knowledge before it gets lost, by the way, and also shift thinking. And created a mind shift that could even go beyond the health sector.
Absolutely. Yeah. These are complex things. And when I think of global health equity, we're also talking about access, equitable access to also the latest, very scientific medical aspects of health. Then alongside that, to have an approach which also embraces localized understandings of health, local culture, the kind of arts practices that you're talking about. It's quite a vision to marry those things together. And I see all of that within global health equity. And also respecting and listening to how people want to engage with that in different places and from different perspectives. That's not all driven from Europe, from America. It's not driven by that perspective that having the University of Global Health Equity based in Rwanda, of course, immediately centralizes a different voice. The Hamge Festival based in Rwanda centralizes a different voice. It's not being imposed from outside an understanding of arts and culture. And I just see such power in that. Is that something that you're conscious of, or is that, again, just my outside perspective and my own kind of biases playing out in my understanding?
Oh, yes, I'm very conscious of that, and I love it, actually. It's a fairly new project. It's been created by a group of that have been working with PH for many years, and PH has been at the forefront of creating the concept of global health equity, saying that care of the best quality can be delivered to the most vulnerable, and this is a matter of good management, well allocation of resources, having the right human resources, political will. Their work in Haiti and in Rwanda is demonstrating that. If you can give quality cancer care in rural Rwanda, that means that you can give it in all Rwanda and in many places of Africa, you see. So they've been building that case. And they are the founder of this university, and it's intentional that it is here. Because miracles have happened in the health system in Rwanda. With the resources that were available, the results are incredible.
If I can just share an experience I had when I was in Rwanda working with music therapy, which really I learned a lot from. It was when I was there at the beginning of my stay in Rwanda, and I was trying to share with colleagues, medical colleagues, about music therapy and what music therapy was. And so I was recently graduated, and I sat with a group of there's a pharmacist, nurses, a doctor, different personnel from a clinic, and presented music therapy. And I did it the way that I'd been shown to at university. And we passed around a drum and we all played something, and we introduced ourselves in different musical ways, and we used different aspects of music as I viewed it. And at the end of the session, the pharmacist from the clinic raised her hand with a question, and she said, "Hey, in the next session, can we do some music?" And in my mind, we've been doing music for an hour. But from her perspective, it wasn't music. It was, I don't know what it was, but it was a different understanding of what music meant. And I think some of that is linguistic. And I think some of it was my belief that the way that in English language we frame the word music is universal. But in fact, there's also local understandings of music. And in some languages, I know there's not one universal word even for music. It's different things which fit under music would have different words. That English sense of what music means is not global. And I think the same is true of health, that one person's understanding of health is different from another person's. The idea of medicine or treatment is different to different people. That was mind-blowing to me, even the idea that music meant something different in different places. And that idea of lived experience, breaking down even those terms, breaking down those constructs, I think is such an important step in what you're talking about.
When you say that, I was thinking about my daughter when she was, she's almost a teenager now, but when she was 3 or something, there's a lot of birds and they're beautiful birds. And she was complaining about the music of the birds waking her up too early.
I can relate to that. It used to annoy me so much. It's beautiful, but let me sleep. I mean, come on.
So you see, I was like, it would never have occurred because I'm a musician. Would never have occurred to call that music, but it is, right? They are singing. So I guess that there's a lot of things, and yes, across cultures, there's a lot of I guess understanding of what music is. And then so many ways of doing music. And what I've paid attention is also the role of music. We've worked, for example, with harmonic people from Sri Lanka that are doing something cohesive, and it's a healing, bonding community practice. There's the role of, what we're listening on radio to comment. But it goes from entertainment to spirituality to healing. So and no wonder people understanding differently, because in all societies, music plays a different role.
Yes. Yeah. And I'm aware too that you use the term arts and culture. You kind of have quite a broad understanding, I think, of that whole realm. You're not limiting it to any particular structure of, well, art should be this or culture should be that. It's a kind of broad understanding as I understand it.
That's something that is very important and that's come from my personal way of thinking. I have a problem with things that are hierarchical. I have a problem with one culture holding the truth. I have a problem with even someone said something that I was like, wow, this is something that is unbelievable. They were saying, like, even with health systems and with the medical approach, someone comes to tell you what is it that you need to do and I'm not going to challenge the full of it, but even in the relationship expert-patient, there's something that could generate an asymmetry of power and information that actually the asymmetry of power came from the perceived asymmetry of information, because the expert knowledge would be more valuable than experience. Which, again, the technicalities of being a doctor, I'm not going to challenge it, but I would like to value the experiences. I'd like to have people being able to tell about what is health, what is my health, so everybody that start to be conscious about that. A bit of my own personal belief, right? And so I guess that, who you are influences your work. I'd like to, in that work where we added culture is exactly because of what you said. You said there's a different understanding of health all across countries, right? All across culture, all across social group, and I guess all across families, maybe.
Yeah.
So being healthy, and we know in some cultures, there's something that is far more holistic than what Western medicine is proposing. If we talk about if we use the word health all the time and we want to be global, who are we talking to? What are we saying and how are we understood? So that's where we need to to include culture. The reason also why I wanted to include culture is because this work that we do goes a bit sometimes without wanting it beyond arts, the arts and art practices. Because again, what is same question that we ask for health? What is art? Who is the artist?
Yeah.
Is somebody that is coming from Beaux-Arts and that have at least 5 exhibitions at the Tate Museum? That child that also creates something and tell a story through drawing. Who's doing art?
Yeah.
That varies across cultures, the definition, the understanding, and the role. And that I found extremely interesting. So we are looking at all of that. We have, for example, a study that it's in process that looks at what's the definition of mental health in Rwanda. And we had this idea to look at that because we had an amazing conversation in the last edition of Hamwe with the people that created the mental health system that we have now in Rwanda.
Mm.
They were saying to us that they had to translate everything. And so they had conversation that lasted 2 days about how we're going to use the word trauma, translate the word trauma. And they were saying, no, it should be this because of that. It should be this because of that. Meaning that even those concepts are hard to translate.
Yeah.
They were saying also that because they were trained in French or in English, depending on where they were trained, and actually even here, the University of Rwanda that trains mental health practitioners train them in English, I think. In the population they serve and their patients, the majority of them, they will speak Kinyarwanda, our national language. So the early days of their career, they spent translating concepts. They also told us that beyond language, the literal translation, there is also all the metaphorical universe that there is in one person's head, right? For example, if you translate, I've got the blues in Kinyarwanda, it doesn't mean anything, right? It was like, why color, right? And so they were giving us example like that, and that they would have to really edit to be able to connect with their patients. And we found it fascinating.
Yeah.
And looked at, so let's understand how people understand mental health here. What is this metaphorical universe that they are talking about? And because we didn't know where to start, right? We looked at proverbs, because proverbs are so interesting in the sense that it's owned by no one, going across generation. Mm-hmm. They are like popular wisdom. Whether you believe it or not, you have a relationship with them that is like, okay, that's general thinking of my group. Right? And so we're looking at what proverbs were saying about emotion regulation, emotion display. Sometimes, there's a judgment or an encouragement. The findings are not yet out, but we're doing this type of work. And that's also really informed on the same way that, when we use the arts as a partner to global health, I think that all those artifacts are also informed and could be a great partner. So that's how the word culture, because then it becomes everything, right? So that's how the word culture was integrated in this department and in this work.
Yeah, and culture is so much about understanding, isn't it? It's about meaning and understanding, how we see the world, which is obviously informed by everything around us, informed by proverbs, informed by the kind of language that we've heard our parents use and people around us use, the important people in our lives use. And if I bring that to our current situation, to the past, where are we now? The past 18 months, 19 months of our experiences of COVID, and in different countries, how that's played out, and for individuals, how that's played out. I see more and more that I think everyone's experience of that has been so different. And if we talk about inequity, we've seen that more evidently than I've ever been aware of, for sure. If I link that, I see that in the coming edition of the Hamge Festival, you have a special focus on stories. You have a competition, in fact, about asking for short stories about people's experience of COVID-19 and life in the era of COVID-19.
Yeah.
I think that's going to be fascinating because, as I say, I think everyone's experience has been so different. And that aspect of story, I think, if we talk about art and culture story and how these kind of histories survive, how they come to be retold, how they come to be lived and experienced, the link of experience to language becomes so important. Maybe you'd like to tell us a little bit about that competition that you've got going on, and maybe also the third edition of the festival, which is going to happen next month, I believe.
Yes, it's in a month from now. It's coming, it goes so fast. So, yeah, the third edition of Hamwe Festival is going to be about the global experience of the pandemic, the social changes that happened, and what it's taught, the early lessons, because even if it's been almost 2 years, I guess it's a bit early to start drawing conclusion, but there are some early lessons and we can start to look back. We have, we have different projects, conversations around the role of the artist in this time of crisis.
Right.
How can they comfort, share information, create some opportunities to reinforce the social fabric that is being put at risk? So all of that will be discussed there. We have also conversations around movement. What happened to a body that doesn't move, right, in lockdown? And what happened to the mind or spirit or brain that is in this body? And what happened to when there is many of those bodies that are in lockdown together? What happened to a community that cannot move? And by movement, we don't want to take it only literally. We want also to talk about movement in careers, opportunities, growth in societies. Yes. And then we also have conversation about reality and truth. So many things have been said about this pandemic. Remember at the beginning how this could be, I don't want to go into the details of what is true or what is not, because this is up to each one to go there. But science and way to do things and status quo was severely challenged, and that affects credibility for some. So who's credible to talk about what to do in time of an epidemic that is so unprecedented? And what does it do when an institution, like in some countries, people didn't trust their government anymore? What does it do to a society when this happens? What other issues are emerging? There's definitely big questions that we have about lifestyles, about structures of power. Again, knowledge. Who knows? Who has the right to talk? And there's a question also about equity. Who were the essential workers in the end?
Yes.
If we value work with salaries and income and so on, right? So we want to reflect on all of that. And those stories, we'll try to share them with the maximum number of people so that we can all see what happened in the life of others and how it reflects to some challenges, existing challenges in our societies, and maybe think about what we do about it.
Yeah. So the festival will take place from the 10th to the 14th of November. I understand that it's both online and with a small audience in Rwanda. So for our international listeners, how can we join you for the festival?
Yes, the festival will be online, and a small audience will be authorized to join the events in Kigali, in respect of COVID prevention rules, of course. And we will have the festival broadcast live on our YouTube channels, the channel of UGHE, University of Global Health Equity, and the one of Hamwe Festival. Both of them will host the festival. Soon after, we'll also, because it's going to be live, but global, we're not always on the same time zone. So very soon after, we'll place all the session on the Hamwe channel so that people can see and participate, with comments in the discussions. We are very good if you want to be inclusive and discuss with people from all over the globe. The social media are definitely an incredible tool. So we also aim at being extremely responsive.
Brilliant. Thanks, Injonge. So we will also, of course, post all the information about the Hamgay Festival on the Art27 website, so people will be able to find how to join you on Facebook, Twitter, YouTube, Instagram, and also to sign up for your newsletter. I love your newsletter, by the way. It's always extremely informative.
Okay, great. Thank you so much for supporting this effort. And I really enjoyed our conversation. It went so fast. Yes, thank you for having me and for sharing all those thoughts. It was a nice experience.
Injonge, thank you so much for joining us. It's fascinating listening to you, and I've loved hearing your views and all of your work. So thank you.
Thank you so much.
ReSounding is brought to you by the Art27 Network, a network of like-minded initiatives using art and culture to respond to the ongoing crisis of displacement of human beings in Europe and around the world. To find out more and to join our growing network, you can visit our website, art27.art, or follow us on Facebook at Art27. This podcast was produced and edited by Ed Holland. The theme tune was written by Matteo Galesi in collaboration with SYNCR. Thank you for listening.